I want to ask Nicole and then Clive, maybe on a more prescription level. What can we do you think, to reestablish trust? And we've spent, I think, a fair amount of time in this section talking about the U.S. perspective, but maybe to the extent you feel comfortable about it, can speak to this on a more global health level, this part. So what should we be doing to try to reestablish that trust?
Sure. So I'll start with the US. In the US, about half the population is expressing hesitancy about getting a vaccine. The major reservations concern safety, effectiveness, and approval processes of the vaccine. So I think it's important to take those concerns very seriously. We don't want to politicize the problem. And I think the problem of politicizing science lies as much on the left as it does on the right, to accept that kind of framing of science as a thing you can claim. We need to focus on appropriate communication, compassion, listening to people, understanding that diverse populations have differential access to healthcare, and thinking about how we can address these problems. We might think about making sure that people of all racial, ethnic, cultural backgrounds and types basically are included in clinical trials. That's important for scientific validity, but also for encouraging trust in the process. We need to have access to testing and immunization. We need trustworthy community leaders and partners. We need culturally appropriate education, translators, and support for people. Obviously, we've talked about the history a little bit of racism. I think it's important for us to understand that racism is not solely the responsibility of Black people or minorities. It would be wrong to ask these communities just to be more trusting. We need to have we need to maximize transparency and explain that the purpose of participating in clinical trials is to help improve the health of the people who the trials are testing, right, the vaccines on, and ensure that they have appropriate support if they do get sick, and that they provide the care for people. I think internationally, it's not quite as bad of a situation. About 70% of participants in one survey I saw globally are hesitant, but a lot will listen to their employers. There's different situations in each country, different groups that might be hesitant. I think we need to have clear, consistent communication with everybody and explain how vaccines work, how they're developed, how the regulatory process works. And then, for instance, the CDC says in the US context, again, when you approach somebody, try to talk to them in a way that makes sure what you're saying is accurate, that you're credible, that you're empathetic, that you show respect, and that you tailor your message to recipients' needs. And I think all that's really, really sage advice. So that's what I have to say.
Thanks. So Clive, hopefully you can hear us. Your last comment on this section before we take on the global allocation and distribution questions.
Yeah, very interesting comments. I want to just paint a starker picture of clinical trial participation. I've worked with, running ethics programs for people in the biopharmaceutical industry with Maggie Little and other people. And, we've run programs where we ask the biopharmaceutical managers and executives if their grandfather should go into a diabetes trial, and then role-played primary care, investigator, IRB roles so that they can ask all the questions they want to. And in a program of about 860 people, only two finally actually agreed that they would recommend to their grandfather they went in a trial. That's pharmaceutical industry people who actually do have access to all of the information. I'm not entirely sure whether we're as objective as we wish we could be about clinical trial participation, even if we are brilliantly informed, as of course those 800 people were relative to most of us. What I think we're lacking is the love and vulnerability aspects of this, because I don't know about you, but I used to take my cues on healthcare from my mom, who would tell me what she thought I should do. And as I got older, I realized she had some wisdom. We have to take into account that the community will decide whether or not when they take part in clinical trials. I'm very heartened by some of the programs in, for example, hypertension, where, if we are talking about African-American communities, where barbershops have been interesting places to learn different things from African American, particularly men in that case, getting haircuts and hanging out with their friends and learning things together and discussing them. That is the sort of initiative, if you want to cut through it, we're going to have to go way off the science here and work into those communities with mums and dads, with pastors, with everybody else. I think that anything top, I mean, the idea of watching even wonderful President Obama and President Clinton, and even if they lined up together and had their shots on TV, I think most people would regard that as a bit of a comedy show. That's nothing to do with my life. Of course they're going to get the right vaccine. They're former presidents. I wouldn't trust that.